Welcome to Senior Care Insights, the podcast where we guide you through the path to exceptional senior care. I'm your host, Dr. Deborah Moerland, the owner of First Light Home Care of Greater Lansing, Michigan, and First Light Home Care of Brighton. I'm a former educator, but most importantly, I'm doing this podcast because I am passionate about educating the community within senior care to make it compassionate and an informed experience for everyone. In each episode, we'll delve deep into the world of senior care. We'll bring you expert insights, heartwarming stories, and practical advice to empower you on this often challenging but profoundly rewarding journey. Thank you for joining us again. For my first interview, Mark Stiles, who is the Director of Marketing and Events for the Orthopedic Rehab Specialist, will be discussing how to help seniors stay independent. My second interview will be with Stefani St, the Business Development Manager of the care team, who will be discussing her position as a community leader and health educator. And she will also provide resources and discuss those regarding the senior community. In my final interview, I will be interviewing Tom Judd, the Executive Director of the Michigan Brain Injury Provider Council, who will be speaking about brain injury, advocacy, and the Michigan auto no-fault law implications. Stay tuned for our upcoming interviews with some of the brightest minds in senior care. Our first guest, Mark Stiles, is a 32-year marketing professional. He's also a 30-year professional musician. If you've heard of Three Men and a Tenor, he's one of the three men. Stage performer and recording artist. Currently, he is the Director of Marketing and Events with Orthopedic Rehab Specialist. Mark loves having the opportunity to tell the amazing stories of courageous patients overcoming obstacles while achieving a new lease on life through effective physical therapy. They get to take pride in their own accomplishments, and it is amazing to see the smile on their faces as they tell him about how much they can do again of things that they just couldn't do before. So welcome, Mark. I'm glad to have you on the show.
Thank you, Deb. Congratulations on the first show. This is fantastic.
Yeah, this is exciting. Let me ask you a few questions about your position and orthopedic rehab specialist. So tell me a little bit about ORS and its history.
Sure. I'll give you the kind of the formation of ORS as it started in Jackson in 1987. And it was formed and founded by two physical therapists that were part of the healthcare system in Jackson that decided to kind of branch out on their own and start their own practice. And it's really grown from there. The two of them added Kevin Barclay, who was the current CEO of ORS. And the three of them started to really look at how they could expand all the services in the Jackson market and reach as many people as possible. And they added, Kevin added athletic training as a service to the physical therapy service that was started. And then they've added sports medicine, and they've added performance training, and they've added a number of different services along the way. And they've also added some new owners to the team. So when Richard Kohler and Jerry Malone started the company, they added Kevin. And then when Richard retired, they added Brandon Klump and Aaron Holly, who are now co-owners with Kevin Barclay as the three local owners of ORS Physical Therapy right here in mid-Michigan, serving Lansing, Jackson, Ann Arbor, and Jonesville. And that was the foundation and the formation of ORS. And really, the mission of the two original owners was that they wanted to create a space for great physical therapy care, as well as make it fun and make it something that people look forward to. And the way to do that was to make the clinic area inviting, make people feel like it was something they wanted to be a part of. One patient has even called it like the cheers of physical therapy, where everybody knows your name, that sort of attitude within the physical therapy clinics for ORS. And then really just building on top of the locations to reach as many people as possible. And so what started as one home, it was basically a house in Jackson in the shadow of the Foot Hospital at the time, has now become an 11 clinic, privately owned physical therapy company in mid-Michigan. And it is continues to be something that we look for new opportunities to add more clinics, not because of the bottom line, but because we're trying to reach as many people as possible. And knowing that we went through the pandemic with 3 years of inactivity and people that were really struggling to get their normal health care, what ORS went through in 2020 was we actually expanded by 3 clinics. Not very many businesses in the year of the lockdown, so to speak, locations, but ORS did. And that was for the purpose of trying to reach as many people as possible. So we currently sit with 11 locations located in Lansing, Jackson, Ann Arbor, and Jonesville. And the company is looking for as many opportunities as possible to support the community through charities and charitable organizations, but also just the health and wellness aspects of our community.
That's great. That's great. I did not realize there were that many locations.
Yeah, no, there were 6 when I started, and since 2017 was when I kind of came on board. Not only has the opportunity been there, but so has the opportunity to hire great staff and continue to look for as many locations as we can open that makes sense to the business model that also reaches as many people as possible. So it's not a matter, like I say, it's not a matter of growth for the bottom line. It's actually really built on let's make sure we're making a good decision to get into the right locations to reach as many people as possible.
That's great.
Yep.
What are some of the common reasons that patients are coming in to be treated?
I would say the predominance of the patients that come in to see us are either managing pain. They're going through something, head, neck, shoulders, lower back pain is very common. Knee pain is very common. Recently, a lot of TMJ issues have been coming into our clinics. Some of that could be caused by just the stress of the pandemic and people, grinding their teeth a little more than normal, and also wearing of masks, we think had something to do with people being more conscious of biting and making those types of gestures kind of caused the migraines and caused the different pains. So we see pain management. We also are very involved with sports rehabilitation. So the young athletes in our area will be coming in for ACL tear repairs, rehab of, surgical things for young athletes, knees and shoulders, and pitchers with arms that are, they're having issues with muscular elements of their throwing arm. We deal with a lot of those types of things. And then the kind of the everyday life type stuff. So we deal with your balance and fall. We deal with your, the older population that's looking to have strength and mobility so they can remain independent. And so a lot of those come our way as well. But it's a real all-purpose kind of business. I really, share with people that when you have a banker, you have a dentist, you have a doctor, you really need a PT in the same fashion that you're always, when something comes up, you start to feel nagging pains or you start to have something you're not quite sure what's going on. If it's about pain and it's about muscular elements of your body, then I would think a PT would definitely be the place to go. You don't necessarily have to go see the doctor first. You can check with a PT at ORS and come in and get an evaluation. And then if we want, to bring you along with more care, we talk with your doctor and make sure that we can do that through a process called direct access.
Oh, great.
Yeah.
That was one of my questions. A doctor doesn't need to refer you to get physical therapy then?
They eventually have to be involved, Deb. What happens though in the state of Michigan, where direct access is allowed, is that we can see and evaluate the patient. They pay an upfront cost, a low upfront cost to just get evaluated. We share that evaluation with the doctor. After we can have up to 10 visits or 21 days with that patient before the doctor has to officially sign the plan of care. So we do get some time with patients before the doctor has to be involved. For example, if the doctors are overwhelmed because of something like the COVID response, a lot of doctors' offices were very busy. And in our case, we were trying to get our patients involved into the PT process without needing the doctor visit first. So that was a very good opportunity for us to use that process. So I always encourage people, you don't necessarily have to start with your doctor to be referred to ORS PT. You can start with ORS PT and we will let your doctor know that this is what we plan to do with you to get you better, get you stronger, get you more mobile. And then the doctors typically will just say, sounds great. We trust you, sign off on the plan of care, and off we go.
So would it be a good idea for elderly people to come in who feel like they're losing a bit of their strength and they're having a harder time getting around just to build up their strength again?
Absolutely. I offer to people that are looking to just get strength and mobility back in their life to remain independent. I know a lot of you and I have talked often. A lot of the people that you're working with want their number one thing is to remain independent. That's the goal of this stage of their life. And what does that require me to do? Well, it may require you to go to PT at ORS, and then from there, we do things to build your strength. We can do some light lifting. We can do some exercises. We'll give you some home exercises. We also have some machines within our company. One, for example, is called the AlterG, which is an anti-gravity treadmill. And I think I shared this information with you for your customers, is that they can come in, get zipped into a pair of shorts that are surrounded by an airbag, which takes up to 80% of the person's body weight off, so that they can continue to walk and or run. And if there's pain involved with them trying to do that on their own sidewalk outside of their apartment, their condo, or their complex, in the AlterG machine, you're held by that zippered bag inside the airbag, and you can actually do all of the walking you need to be doing for your lower extremities, but you're protected and you're safe from falling or necessarily hurting any of your lower extremities. But we do see balance and fall customers quite a bit. People who are just uneasy on the ways that the curbs and the sidewalks are in Michigan, especially maybe going into the winter season where you have snow and ice. We can work with the elderly population, actually any age, but especially we find it to be the older population, just not sure of those different levels. And so they'll come in to learn how to react if they step on something or they see a curb or something that may cause them to lose their balance. Then we can teach them how to lose your balance and how to respond to that. So some people may not even realize that physical therapy is an assist for that type of, for that part of your life, for those types of things that happen. Just the everyday things that happen for that age group all the time.
So can anybody use this new machine? You called it the
The AlterG. AlterG, yes. There's a page on our website, orsmi.com/AlterG, and you can see a video on how it's used. But yes, you can purchase minutes on it if you'd like to do that outside of a plan of care. Or if you were a patient of ours and we had a plan of care, it can be covered by your insurances as well if you're part of the ORS patient. And then we can put it through the insurance process. But it also can be purchased if you wanted to just do minutes on something like that and wanted the security and the safety of knowing you're held while you're walking, or even if you wanted to try running. That's another way to use that AlterG machine. But, we're starting to see a lot of the pickleballers, from that age group that's starting to, go back to their youthful days of athleticism, and they realize, I have a different body than I had 40 years ago.
Right.
We're also seeing that age population as well coming in for services, and we're happy to treat them all. Like I say, if you're looking to have that PT and you're kind of in your Rolodex, like you do your auto mechanic for your car and your doctor and your dentist, and we want to be that for as many people as we can reach in mid-Michigan.
So what specifically do you do to help with the aging population besides the fall risk and mobility? Are there specific exercises that are done, or do they get training on different things?
All of those things, and speaking in generalities, as we know that each individual would be given a certain plan of care, I would say that it's all we have at our Holt ORS Holt clinic in the Holt Plaza. We have a new treatment process called Core Sticks, and what that is it's a board that you stand on, and you have basically cross-country ski poles that you put into certain holes on the board. And so there's some resistance training and some strength training done there while you stand flat-footed on the board. And we've seen great progress with the age group of, say, 50 to 70 has been put through the Core Sticks board, and it's just shown great growth in strengthening. Again, it's a balancing thing as well, because they're using the sticks to kind of balance while they get stronger, and the resistance training has helped there. We have heavy weights, so if they wanted to do some things with, the lifting of the cross beams, we can put weights on there. We have free hand weights. We have the bands that we can send home with people for home care. And they do get, if they come in as patients, and that's what we encourage, is we're hoping all of your watchers and listeners would consider coming to ORS for PT. There is also a home program through a video platform called MedBridge, where the patient can then actually get some home videos, which can help them guide them through that sort of thing as well. And we find that the older population likes those home videos because it's the security of their home, it's in the privacy of their home. They can kind of do it on their own time, and they're not in a gym necessarily. They don't feel like anyone's watching them, and they can still do the things that we want them to do to get better.
So how do you motivate the elderly people to come in and actually do the physical therapy? I've seen many of our clients, they might have a physical therapist come 3 days a week.
Yeah.
All the rest of the time, they don't want to do what they need to do.
Yeah.
But you mentioned they are excited to come in there. So how do you keep them motivated when their treatment plan is done?
I was just about to say other people around them is the way to motivate them. It still has that same like schoolyard mentality that it's like, if someone's watching me, I don't want to look stupid. And so I'm going to try really hard to do it. So that's why we also, I guess I should make sure to mention here, and I almost forgot to, is our aftercare program is part of all of our clinics, where when a patient finishes, they can pay a small amount of money per month and remain part of our clinic. For the motivational side of things, for the equipment that they got used to during their treatment. And they pay a small monthly fee. I think it's $50 for the month. I could be wrong. I think it's $50. And they can maintain their relationship with the PTs and with the staff if they felt welcomed, if they felt like it was something that made them do the things they should be doing. That aftercare program is really nice. And the only thing we cannot do is we can't put our hands on them. We can't treat them while they're in our care. But we can certainly be cheering them on and be guiding them through what machines they can use. So it's like having that kind of advisor, right, looking over your shoulder in the same setting as you were comfortable with. And with the trust, we know the trust is very important for the elderly population with their care providers, trust and security and safety. And if we provide all those things within the walls of the ORS clinic, we hope they come in, they're going to feel welcome. The front desk will learn their name instantly. There's a smiling face and a cup of coffee waiting for you. And then the familiarity of the machines you were used to using and the staff you got to know pretty well. So but the aftercare program is also a great way to reach that older population that still wants to remain involved.
Okay. I think that's great that there are options to get people stronger before they actually, fall or get injured. And, people don't think about doing the physical therapy until they actually have to do it. Whereas if people are being more proactive, there'll be fewer people in the hospital and having to do the recovery.
Yes. And I should say we also see a lot of pre-operational patients that are getting ready for the big hip replacement or the big knee replacement or the shoulder. All of those were big replacement surgicals. We see people come in and get stronger before the surgery. It's called our prehab, or instead of rehab, it's prehab. And we get people in and we work with them, get them stronger. And then they get their big operation done. And then when they come back in for their PT that's been scheduled, then you can actually realize that, they're further along than they would have been. The muscles are not as, weak as they were. And so they're actually going to have a shorter rehab time or have a more successful rehab because they prep those muscles before the surgery. So your age group, but also just anyone involved with like that independent living, if you're having a major operation done, consider PT as a way to get ready for your surgery. I know that sounds crazy because you're like, I can't prep for that because I don't want to do it. But if you have to have that surgery, then you should probably get those muscles ready. It'll make the aftercare easier and possibly get you back on your feet and independent quicker.
Right. Quicker recovery. That's always a good goal.
Yeah, for sure.
Well, thank you so much for joining us on the Senior Care Insights show. I appreciate it very much, and we'll hopefully have you back on again in the future.
Happy to do it. Congratulations. Good luck with the show.
All right. Thank you so much. Time is valuable, especially when it comes to caring for a loved one. Instead of spending your day juggling caregiving tasks, you could actually spend quality time with your family, enjoying the memories, playing games, catching up on work, or simply relaxing and getting recharged. A client review stated, "We used First Light Services to care for my mom for almost 3 years in her home. We were very lucky to find such loving and compassionate caregivers. They were knowledgeable about mom's issues and truly cared about her well-being, as well as helping the family learn how to adapt to her changes. Our caregivers are professionally trained, background checked, must pass a drug test, and are compassionate. We offer flexible plans tailored to meet your family's needs, ensuring that you get time back in your day without compromising the quality of care. Don't let another day slip away being a caregiver. Make the call today and let First Light Home Care of Greater Lansing illuminate the pathway to exceptional home care and give you back the gift of time. Welcome back to Senior Care Insights. Today, our next guest is Stefani St. She's a passionate business development manager and dedicated volunteer community health educator representing the care team, health, and hospice, which provides services such as palliative care, nursing care, and hospice. Her previous experience includes dementia care approaches and de-escalation techniques. She also has developed comprehensive staff training and educational programs. In addition to her professional career, Stefani extends her outreach to the community, educating individuals on understanding and navigating senior benefits. Welcome, Stefani.
Hi, Deb.
Today?
I'm good. Thank you so much for having me. This is very exciting. Your first episode. Congratulations.
Well, thank you. And thanks so much for being on our first show.
You are welcome.
So I have some questions for you. I'd love to hear more about the care team and how you are helping them. So as a community health educator, what is it that you do and how does it relate to your position with the care team?
So the care team was founded in 2015. And since then, we've grown to be the largest home health and hospice company in the state of Michigan. We've even expanded into Texas, Indiana, and Pennsylvania. So we're growing, and that success doesn't, come without reason. So our staff and our culture and the care that we provide to our patients is just unmatched, honestly. Maybe I'm a little biased, but I've worked in this industry for a long time, and I truly believe this is the ultimate company. So that's kind of the care team. We'll talk more about them for sure and what they offer as home health and hospice. But as a community health educator and business development manager, some things that I do are just really creating awareness in the community, providing education. I work closely with senior living communities and lots of resources, local physicians, hospitals, case managers, and really just try to close the gap between the patients and families and healthcare. And so I'm the person that comes in and makes sure that everything is tied up in a bow and get people the care that they need. I also sit with families and explain to them their benefits, eligibility, and explain Medicare criteria, things like that.
Oh, great. So what kinds of things are most common when you're helping families and community partners?
That's a good question. So something that's really common is that there's a need for just clear and comprehensive communication and information about healthcare options. So for people to know what things are out there, largely people don't know that they can receive a lot of care in their home, wherever they call home. So if that's a senior living community or in the comfort of their own home post-op, or otherwise. So that would include nursing services, PT, OT, speech therapy, home health aides. And I know we'll get into some of the services we offered, but that's one of the things we encounter. Another thing is people just not being aware of the benefits that they're eligible for. And we also encounter concerns about long-term healthcare planning. So we plan for college and the birth and weddings and all kinds of things. So we should also be planning for healthcare in our older age. And it really empowers us as individuals. And then it also allows us to communicate those thoughts with our families and lets them to know what we would like in our age. And so even the legal aspects and emotional conversations that come up with that, it's just a good thing to plan for those things. So that's a couple of the things that we see.
Oh, yes, definitely. Planning is definitely key to having what you want when you want it in the future. I know that many people wait until there's a major crisis and then they call and then they take whatever is available, and they don't really have time to prepare. So it's really good to plan ahead for things that could possibly happen. And if they don't, that's great. But
Exactly.
if they do, they're prepared. So what do you think is the most important as someone progresses in age or in their prognosis?
Yeah, I think you brought up a really great point. I actually am doing a lot of educationals right now about planning before a crisis strikes. So you nailed it. So when a crisis strikes, we're often overwhelmed by decision making. You don't know who to really trust, and you're just kind of leaning on whoever comes to you and tells you what to do. You're doing that in a moment of crisis, and so you're not able to research companies and really do your due diligence and feel empowered to make those decisions. And that's a piece of dignity. That's part of our independence, and that's really important. So planning before a crisis, when we also have chronic conditions or serious illnesses, we can end up in the hospital at any time, or maybe having a fall, or anything can happen. And so being prepared, knowing who you would call, making sure that you're looking these companies up and finding out more about them. A lot of people think that home health and hospice and a lot of the services is kind of an umbrella. So hospice is just hospice, and home care is just home care. They don't realize there's so many agencies, private agencies, that offer these services, and they're vastly different. So we're required to provide a certain amount of things, but we provide a lot more as well. And, people should just be really asking questions about their reputation and longevity and the type of clinicians they have. Our staff is just amazing. We have amazing, phenomenal staff that we get to see work directly with our families, and they're front facing. And so I can, educate and speak all day long, but really the proof is in the pudding, as it were. So when the patients are working with those clinicians, they're also educating them and building those close relationships. So those things are really important. Another factor with planning before a crisis occurs is having open and honest conversations with your family members and healthcare providers. So people have been going to their providers for years and years. It's important to continue to go to those appointments because we collaborate with them. And so when somebody does need home health, what we're going to do is reach out to the primary care physician. And so they need to be staying up on those face-to-face visits so that everybody is really in the know with what's going on with that patient. So we're able to really draw a big picture and have all of that information. And then it just allows them to have access to high quality services. So if somebody approaches them under crisis and they're set up maybe with somebody who is not providing the best care, then that's a real disservice to those individuals. And they should definitely feel like they are not a number. So we are really proud of the fact that we treat everybody as an individual. So our care plans are structured and tailored to fit the needs of not only the patient, but the family. And so all of those details are very important to think about.
Oh, definitely. Definitely. Do you want to share about some of your services that you provide that people would like to know about? For example, I hear the care team and just the name doesn't really explain everything that you guys do. So if you could just go over some of the key things that you guys provide and what makes you stand out from other companies that are similar to yours.
Yeah, those are some great questions. So the care team, first, the home health aspect, we're providing skilled nursing in the wherever somebody calls home. We're providing medication management, chronic condition management, wound and skin care. We offer infusion services, and we manage a lot of those medical equipment that others cannot. And then a big thing for us is that we're available 24 hours a day. So even on the weekends, that's a big question to ask the companies that you're being set up with. So even on the weekends, we're going to be available to not only home health, but hospice as well. We also have speech therapy, and we connect people with medical social workers, as well as, there's some psych nursing included in that as well. So really a full circle of care. It is about that holistic approach and making sure that everybody's needs are being taken care of. And then we also have hospice services. And so with hospice, you have a nurse case manager, a home health aide, chaplain services, and we also have other services. So we have massage therapy and music therapy, and those things can help with circulation, comfort care, and just really soothing a patient when they need it most. They also have a social worker that's going to help them work through those. Maybe there's family dynamics that we can assist with, or, legal aspects, again, coming back to that. So we're really going to help from start to finish. I myself am part of that package as well. So business development manager and volunteer community health educator. So I go into people's homes or meet them, wherever they're comfortable. And I really go through those things and make sure before they choose to accept home health or hospice that we're talking about the expectations and really taking them through a step-by-step process, because, we're in the healthcare arena and we hear the acronyms and all of the verbiage every day. And so often we don't realize that other people don't know what those mean, those letters and all of the words mean. And so I find that really sitting down, making sure people know that I'm there for them. There's not a time frame on that. So I'll bring coffee and answer all their questions. And then I provide my personal cell number. So I'm also available to families so they can call me. And I work, with lots of people like yourself, Deb. So we've worked a lot of years together, and you're an amazing resource. And people like us have resources because we work so closely in the community. And so if somebody needs something outside of home health or hospice, then I'm able to connect them as well. So just a really broad list of things. I'm sure I could go on and on.
Right. I think a lot of people don't realize there's a difference between home care and home health. And home health is more of the skilled side, and the home care itself is more of, the private duty, the cleaning, the mobility,
right,
and dementia care. But people often think, oh, well, my insurance covers home health. Well, that's different than what they're asking for. So we'll probably have another conversation about that in the future.
I would love to. Yeah, absolutely.
I think that's really important that people understand what different companies can do for them. So,
yeah. And that's one of the questions that does come up often when I'm doing like Q&As with families or at senior centers is, what is the difference exactly, like you said, between home health and home care, and understanding what's covered, what's not covered, and how they can save paying out of pocket. Sometimes they can save when they're getting the health and care they need.
Right. So you mentioned that you have some tools that you have that you use to help people organize and plan their care choices for the future. Can you go over some of those with us?
Sure. So you can see behind me that we have lots of educational and marketing material because, again, we're deeply rooted in education. We really want people to be empowered. And I can talk to people all day long, but it is overwhelming information. So we like to give them something to take home so that they can revisit those and remember what we're telling them. So lots of different checklists and things. I know there's a little bit of a glare, but just kind of shows what we provide. And then let's see here, a couple of the details that are in like a home health or a hospice booklet. When we do consents with patients and families, we provide them with one of these books. A lot of people are familiar with the Gone From My Sight book. And this is not put out by the care team. It's actually put out by Barbara Kearns. She was a pioneer of hospice years ago. And so these are really helpful in helping people navigate, especially when they're dealing with end of life. And then we have a really handy checklist here. I'm not sure if you're able to see that, but this is for a home care patient checklist. So it goes through what to look for. So activities of daily living, if you're fall risk, feeling really weak. We have a lot of Parkinson's patients that sign up for our services because we're able to help them stay stable and re-strengthen themselves. And then down at the bottom is the hospice patient checklist. So we're talking about criteria. And the thing to think about with hospice is, it's changed so much from the 1500s to what it is now. And there's such a stigma related to it. So we call it the H word because it's kind of a scary term and word. We also call it comfort care because that's what it is. And so we're looking at quality of life over quantity of life. And so we're keeping people from having increase in hospitalizations. We're keeping them home where they're comfortable. And the criteria allows people to sign up for that care. And it doesn't necessarily mean anymore that somebody's going to pass in the next couple of days. We certainly try to educate about early admission so that their length of stay on hospices is longer and they're able to pass comforted in their homes as well as their family. And so we have people who are on hospice and actually graduate and go off of hospice after they receive the care they need. And we can have people can go on hospice for months and even years in some cases, rare cases. So just understanding and being open-minded that it is an eligibility benefit and not necessarily something to be afraid of. It also is going to cover a lot of different things like your medical equipment and some briefs and medications related to the prognosis. So all of those details really play a whole part, and those are some of the things that I would talk about when I go into the home. Some of the other tools that we provide, that's not a printed item, but we're always in the community and senior living communities, senior centers, lots of events all over, health fairs. We partner with other community resources so that we're able to reach out to the community and provide further education. And we're always open to new things. So I've had families reach out and say, I could really use education about XYZ, and I'm happy to make that for them and then go and speak to their group or whatever works for them if there's a need there.
Well, that's awesome. Well, thank you so much for coming on our show, and we appreciate it. And like I said, we'll probably have you back in the future, and we'll discuss some other things that many people need to know about in terms of senior care. So Excellent. Thank you so much.
Thank you. Thank you, Deb. It was a pleasure being here. And I would love to come back sometime. And again, congratulations to you. I know you'll have lots of education on your show here and on your podcast. So it's a good thing that you're doing.
Thank you so much.
All right, Deb. Have a great day. Bye-bye.
You too. Bye-bye. Time is valuable, especially when it comes to caring for a loved one. Instead of spending your day juggling caregiving tasks, you could actually spend quality time with your family, enjoying the memories, playing games, catching up on work, or simply relaxing and getting recharged. A client review stated, "We used First Light Services to care for my mom for almost 3 years in her home. We were very lucky to find such loving and compassionate caregivers. They were knowledgeable about mom's issues and truly cared about her well-being, as well as helping the family learn how to adapt to her changes. Our caregivers are professionally trained, background checked, must pass a drug test, and are compassionate. We offer flexible plans tailored to meet your family's needs, ensuring that you get time back in your day without compromising the quality of care. Don't let another day slip away being a caregiver. Make the call today and let First Light Home Care of Greater Lansing illuminate the pathway to exceptional home care and give you back the gift of time." Welcome, Tom. This is Tom Judd, and Tom is going to speak to us about the Michigan Brain Injury Provider Council today. He's our final guest on our first show. So Tom is a seasoned leader with over 15 years of experience in providing direct services to individuals living with brain injuries. And he stands at the helm as the executive director of the Michigan Brain Injury Provider Council. His extensive background includes not only hands-on experience, but also a strong track record in organizational leadership and public policy advocacy. Under Tom's dedicated guidance, the MBIPC Council is on a mission to empower its members, enabling them to deliver top-tier, ethically driven rehab, healthcare, and associated services to individuals who have brain injuries. Their commitment to the excellence shines through their efforts to enhance the quality of life and care for those in need. And welcome, Tom, to our show. We
Thank you,
appreciate
Deb.
you joining us.
Happy to be here. Thank you.
So, could you go into detail and explain what the Michigan Brain Injury Provider Council is and what its mission is?
Yeah, well, I think you summed it up pretty good, but I'll expand a little bit. Yeah, we are a 501c6 trade association. We've been in operation since 1987 and have grown considerably over the last couple of decades. Our membership represents the post-acute continuum of care in Michigan. So we have in-home care agencies, residential programs, supported living, case management, transportation, pharmacy, durable medical equipment, even a couple of hospital systems and some physicians. So a really diverse group of providers who come together as a network, as an association with one common goal, and that is to enhance the lives of people living with a brain injury. So MBIPC provides opportunities for professional development and continuing education, as we really want to uplift the industry and uplift the quality of care and services being provided to people. And we also provide key advocacy and legislative public policy updates to our members as we work to break down barriers to access to care for people with brain injuries.
Awesome. And what are some of the most pressing challenges in the brain injury care field that the MBIPC has addressed recently?
Yeah, so like I said, we really focus our legislative activities on breaking down barriers to access to care. We know that there are over 200,000 people living in Michigan with brain injuries, and more are sustained every day, from a mild concussion to a severe traumatic brain injury. And we want to be there to ensure that everybody has equal and equitable access to care. And that's not in our systems right now. So we were successful this past budget process to get increased funding for the state's Medicaid program, brain injury services program. This program has been on the books, if you will, for a couple decades now, but the funding has not increased as the cost of living, cost of medical care has increased. So essentially, the program was inaccessible because providers simply couldn't open their doors to people under that funding stream because the reimbursement was less than the cost of care. So we worked hard during the appropriations process, and we secured a significant increase in that program so that this program is now accessible to people in need. We've also been at the forefront of the fight for the last 4 years to fix the auto no-fault reform law that stripped away access to care for people injured in a car crash. That law had a stipulation in it that cut reimbursement rates for essential services that resulted in people being discharged from placements, and now people injured, from today and beyond will not have access to those post-acute care. So we have been working hard on that effort, and we're optimistic that we'll see some traction here soon.
Okay. Some of the issues that have happened with the auto no fault include people not receiving any care that was provided before. What other consequences occurred because of that?
Well, we could have a whole podcast on the problems with the auto no fault reform law. There's many, but we have been focusing our efforts very narrowly on this reimbursement issue. And you're right, this reimbursement issue caused people who have been receiving care for decades to be upended. Several, people losing access to care. For a lot of people, that meant being displaced from their own homes. People who received in-home care up to 24 hours a day simply didn't have that care anymore. And so they were displaced from their homes, either put in a nursing home, rehospitalized, or just going without care. And it's a tragedy. Some of these people have some hope with the Supreme Court decision that occurred over the summer, where it stated that the legislature did not specifically state that these provisions apply to people injured prior to the law passage of 2019. And so those people's services were restored But everybody injured after still has these provisions apply to them. And, the tragedy will continue if we don't see a legislative fix.
Correct. Some people think they have this insurance that will cover it and they're paying for that. However, with the reimbursement rates so low, they really aren't guaranteed that they'll get any services whatsoever.
That's true. So another provision in the 2019 law gave people a choice on the amount of personal injury protection that they would like to take out in their policies. So no longer is it automatic that everybody has lifetime benefits. You would have to choose that, and still today most people are choosing that. Unfortunately, as you indicated, the policy is not really worth much, because if you are in a catastrophic car crash, and nobody thinks it's going to happen to them, nobody ever thinks it's going to happen to them, but getting in
Right.
your car is probably the most dangerous thing you do every day of your life. And it can happen to any of us. It happens to about 3 people every day injured in a catastrophic car crash. And sadly, what these people are going to find out is that after they get through their hospital stay, there's not going to be many options to go. Certainly, they're not going to be able to go home with 24 hours care. They're not going to be able to go to community-based settings that have experts that deal with these injuries. They're either going to go home without the care they need, or they're going to end up in a nursing home. And not to disparage nursing homes. Nursing homes are vital for people that are appropriate for those settings. A young 20-year-old who has an opportunity for recovery and rehabilitation, a young 20-year-old who may be paralyzed or have a permanent brain injury for the rest of their life and need expert, very close attention and expert care. A nursing home isn't appropriate setting for that. So this is the reality that we continue to fight, because drivers are making those choices and they deserve the promises that they're signing up for.
So a couple of days ago, you had a rally at the Capitol. How did that go?
It was great. It was great. It was so inspiring to come together with crash survivors, families, and medical providers, unified with this goal, to pass Senate Bill 530, which was introduced a couple weeks ago. Senate Bill 530 gives us the solutions we've been looking for: a reasonable fee schedule that allows businesses to get back to business and provide the expert care that Michiganders deserve. So the rally was great. We had several hundred people come. It was hot for an October day. We were worried it might be cold and rainy, but it was 85 degrees. So people bared the heat, found some shade, and listened to a great slate of speakers that talked about their firsthand experiences, and heard from legislators who came out and voiced support for Senate Bill 530 and stressed the urgency for it to move swiftly.
Okay. What other ways is the MBIPC working to educate the community about the auto no-fault law and other issues related to traumatic brain injuries?
So we're part of a coalition. It's called CPAN, and they're really a consumer advocate organization who extends beyond just access to care, but also consumer advocacy. As we talked about, having policies that have some teeth, making sure that insurance companies are being held accountable for their rate making, for how they write their rates. There's provisions in the 2019 law that say they get rid of non-driving rating factors such as zip code or credit score, but those factors are still being used. And what's happening is people in Detroit are having the highest rates, continue to have the highest rates in the country, just because of where they live or their credit history, nothing to do with how they drive. So CPAN is a great organization that MBIPC is a proud coalition partner in that kind of auto no-fault space. But MBIPC is much more than that. And we continue to look at other systems that need some advocacy to break down barriers. Commercial health coverage, here in the state, there's no mandatory provisions that commercial health coverage covers things like post-acute care, residential treatment. And there's other states around the country that have models for this, such as Texas. And so we want to look at that model and uplift our commercial health system here in Michigan so that if you suffer a stroke, you receive the same services that somebody should if they were injured in a car crash. So we're looking at other systems. The Medicaid program, as I mentioned, we're proud of the work we did to make the program that's currently in the state accessible, but we need to do more. We need to look at other states that have long-term care opportunities for people on Medicaid. And so a lot of work to still to be done, and we're going to keep working hard.
Okay. And who could join the MBIPC, and how would they go about doing that?
Yeah, you can jump on our website, MBIPC.org. Check out all the great things that we're doing, but there's also a membership form there that you can fill out. Really, it's open to anyone that has a vested interest in our mission. So there are individual members who are not necessarily affiliated with an organization, but support the work that MBIPC does. But also any provider that services people with a brain injury really should be part of MBIPC, not only for the advocacy efforts, but also for the professional development and networking opportunities to be part of this network and association of colleagues who have the same mission. So, if people or organizations are interested, they can go to mbipc.org. And if they have any questions, my contact information is all over the place there. So, they can email me or call me and we can have a talk.
What kind of educational opportunities are there on the site?
You'll see about there's a section of that detail the educational opportunities. We have monthly educational opportunities. We have a Learn Over Lunch that's done sometimes in person, sometimes virtual, and that's really focused on clinical practices, best practices in the clinical sphere. And we also have Wednesday webinars every month. And this is a virtual option that we kind of expand. Certainly we'll hit on clinical issues and best practices, but expand really to business practices. For instance, we have next month, we have a guest speaker from Moonsail North, who's a PR firm that we work with. They're going to talk to our members about social media and branding, giving some tips. So on the Wednesday webinars, we really branch out. We also have an annual boot camp that is really focused on business practices, and that's exclusive to MBIPC members, and much more. So we share resources, we share information beyond those formal events, and it's ongoing and continuous.
Sounds like a great opportunity for many people to join. So
I think so. Yeah. It's about uplifting the care and quality of services for people with brain injuries. And so you don't have to necessarily be a direct provider. And if you want to be an individual supporter and just be in the loop and have these educational opportunities. Absolutely.
Okay. Well, thank you so much, Tom, for sharing your invaluable insights and expertise with us today. It's been a privilege to have you on Senior Care Insights. And to our listeners, if you found today's discussion as enlightening as I did, don't forget to subscribe or follow us on your preferred podcast platform. That way you won't miss any of our upcoming episodes and our remarkable guests that will be coming on in the near future. If you have any questions, suggestions for future topics, or would like to learn more about the Michigan Brain Injury Provider Council, feel free to reach out. We'd love to hear from you. And then join us next time as we continue to uncover the insights that matter most in senior care. And until then, take care and be well. This is Dr. Deborah Moerland signing off from Senior Care Insights. Thank you. Thank you so much for joining us on our first podcast, Senior Care Insights. I'm Dr. Deborah Moerland, and next time we will have some other guests that are just as fascinating and fabulous as the guests we had on this show. Thanks again to Mark Stiles from Orthopedic Rehab Specialist, Stefani St. from the care team, and thanks also to Tom Judd from the Michigan Brain Injury Provider Council. We appreciate their time, and I'm sure that there is a lot of information that you have gained, but just keep watching. We have more to come. Deborah Moerland, First Light Home Care. Time is valuable, especially when it comes to caring for a loved one. Instead of spending your day juggling caregiving tasks, you could actually spend quality time with your family, enjoying the memories, playing games, catching up on work, or simply relaxing and getting recharged. A client review stated, "We used First Light Services to care for my mom for almost 3 years in her home. We were very lucky to find such loving and compassionate caregivers. They were knowledgeable about mom's issues and truly cared about her well-being, as well as helping the family learn how to adapt to her changes. Our caregivers are professionally trained, background checked, must pass a drug test, and are compassionate. We offer flexible plans tailored to meet your family's needs, ensuring that you get time back in your day without compromising the quality of care. Don't let another day slip away being a caregiver. Make the call today and let First Light Home Care of Greater Lansing illuminate the pathway to exceptional home care and give you back the gift of time."